Hi, everyone, and welcome back. Thanks for tuning in to the final day of the adult meeting. This has been a lot of information to process. Having full day webinars is accompanied by its own unique form of exhaustion. So remember to be kind to yourself and learn this material as you learn this material, and continue to take breaks as needed. Also, please remember to fill out the brief meeting survey located on the event website. There's only one survey for the entire event. It should only take just about 5 minutes. Our first session today addresses international care for adults with FA in Brazil and Mexico. As we adapt to hosting virtual events, we are committed to identifying ways in which our meetings will be more inclusive and representative of the international FA communities. As you can imagine, FA care in each of these countries is accompanied by unique barriers, some of which include access to medications, diagnoses, technology, financial barriers, geographical barriers, limitations to psychosocial support. So Dr. Carmem Bonfim, Director of Blood and Bone Marrow Transplant Program at Federal University of Paraná in Brazil, and Dr. Carlos Hernandez, adult hematologist from Mexico City, are going to discuss some of these barriers and share about FA care in their countries. Dr. Hernandez was unable to be here with us today live. However, he recorded his presentation for us. So first, let's welcome Dr. Bonfim. Welcome, Dr. Bonfim. Thanks so much for being here with us today.
Hello, everyone. It's a great pleasure to be here, and I thank very much FAF for giving me the opportunity to talk about Fanconi anemia adult patients and the care of these patients in Brazil. So I will start by sharing my screen. Let me see here if and everyone can see the screen. Yes?
Yes, we can see your screen just fine.
Thank you. Thank you. It's just now that because of these virtual meetings, we need to ask people to confirm that they are watching the screen. So Fanconi anemia, everyone always begins in these kind of lectures with a conflict of interest slide, and this is absolutely my slide. I have to tell you all that access to adequate treatment of patients with these life-threatening diseases is limited to a minority of the world population. The place where you were born, the socioeconomic status, they all will influence a lot your access to curative treatment. So I would really like to see comparable survival and adequate treatment for patients all over the world. We would need to go deep in research to find simple solutions for these complex problems. Medicine is getting more and more sophisticated and expensive, but if we continue in this way, we will only benefit a very, very small amount of the world population. So I have been asked to talk what are the major challenges for adult patients with FA and what they have to face in Brazil. And of course, this is a physician perspective. And I will begin by telling you a little bit about the amazing improvement of survival after transplant, even in developing countries. Then I will touch about new protocols for patients with advanced diseases, especially myelodysplastic syndrome and acute myeloid leukemia, the never-ending need for more research regarding endocrinological complications and cancer. And I will just finish with some of the psychological education and job issues that we may have here. So for those who don't know us, we are located here. I'm a pediatric transplant physician, even though we take care of Fanconi anemia patients throughout their life, so they do not move to the adult care. We have an adult care set up for them in our unit. So we are located here in the south of Brazil in a city called Curitiba that has approximately 1.8 million inhabitants. And we have a lot of experience in Fanconi anemia. We have up until December 2019 performed more than 400 transplants in 378 patients. And we also follow more than 100 patients, non-transplanted patients a year. We see between 20 to 22 new patients every year, and we have approximately 600 consultations for FA in our center. I'm very worried about the pandemics because we decreased the number of patients coming to the unit, especially because Brazil is very big and the travel distances are high, and patients are really worried about visiting other centers and traveling during these pandemics. So let's see what will happen next year. So let me just tell you about the results we have for matched related transplantation. And the indications are the same as you have in the US. We usually send patients to transplant if they develop pancytopenia, that is, if they become aplastic, or if they develop myelodysplastic syndrome or acute myeloid leukemia. Of course, we always screen matched siblings for FA to exclude their mice patients. And we have this very simple and effective protocol using only 2 drugs, cyclophosphamide, and for patients over the age of 11, we add this drug called ATG that decreases the number of T lymphocytes and decreases the incidence of graft-versus-host disease. So with this very simple protocol without irradiation, we have achieved in the last 10 years almost 100% of survival in these 45 patients that were transplanted. And we don't see the need at all to give you radiation for matched transplantation. And the only problem we have here is screening for cancer and other complications related to the disease. The same kind of improvement has been observed for patients receiving matched unrelated donors. And this is especially, this is very important that they have now received less transfusions because they are referred early for transplantation, and also because the addition of a marvelous drug called fludarabine. So in Curitiba, if you don't have a matched unaffected related donor, we usually begin danazol while we initiated the unrelated donor search. If we find a 10 out of 10 high resolution match, then we proceed immediately to transplant. As you can see here, I was able to see this increase in survival ranging from 12% to more than 8% of survival. And nowadays, matched related, if you have a matched related or a matched unrelated donor, the survival is almost the same. And this is also true because Brazil has the 3rd biggest unrelated donor register in the world. We have more than 5 million donors, and this helps us find donors for our patients. So if we don't have a matched related or matched unrelated donor, then as I told you before, we begin androgens. Androgens are very important for this population because we achieve almost 80% of response for patients that receive either oxymetholone or danazol. And while this is not a curative treatment, it may give you time to find a better donor or even to become smarter and decrease the toxicity of the transplant regimen or other therapies that are available for patients. So we also participated in a very nice study that involved almost 200 patients and included patients from Europe, Brazil, and USA. And as you can see here, the survival is lower when compared to the patients below the age of 10 transplanted from matched related donors. But you can also realize that most of the adult patients, they come to the transplant with advanced disease. And that after 2000, because these include patients transplanted from 1991, but after 2000, improvement in survival has been observed even for this group of patients. And we have achieved almost more than 80% of survival in 3 years, especially if you have a matched sibling and you use bone marrow and fludarabine in the preparatory regimen. In Curitiba, we have seen this improvement, especially during the past 6 years, where, as you can see here, in the beginning, we had like just very few patients, 8 patients, and most of them, just 2 are alive in this first period. The second period, we had 14 patients and 2 patients who are alive and well. But from 2015 to 2019, we had 17 patients transplanted between the age of 18 and 39 years, most of them with advanced disease. So the profile of the patients did not change. But these patients received new protocols for transplant and new protocols for advanced disease, and we have 14 patients that are alive and well. That's why we need these international studies, and this is a very nice study that we did together with the group from France, and that's Regipe Fodelatou, where we give a chemotherapy with a flag, chemotherapy code flag, and it's a sequential. We give the chemotherapy and the transplant for the patient. And with that, we have seen an improvement in survival for these patients as well, because they relapse less after transplant. So this is how international groups can get together and improve patient care. Many people also ask us, why are you doing haplotransplant with this post-transplantation cyclophosphamide? Why are you not using T-cell depletion, alpha-beta T-cell depletion, or very sophisticated T-cell depletion methods? It's just because we don't have it. And the majority and most of the countries around the world, they do not have these techniques available. And we had lost almost 25% of our patients that were included in the donor search. And we decided that it was time to move on, especially because the results we had with cord blood was really dismal, and with only 34% of survival. And this is not because we don't know how to do transplants in FA, because we had an excellent survival with bone marrow. It's because it's a more complicated transplant as well. So that's why in 2012, we published the first 3 patients transplanted with a haplo donors and post-transplantation site. And this was the idea from the Seattle group that we really took it in our hearts and to develop. And up until now, we have more than 60 patients transplanted. But if we included patients only until 2019 to have a better follow-up, then the survival approached almost 80% in these patients. That's much better compared to the cord bloods that we are using. With these amazing results, so what do we have to face now? And this is cancer. Cancer is the major cause of death in transplanted and non-transplanted patients. And that's why we need a multidisciplinary team to work together. And this is here below, you can find the dentists that we have there, led by Dr. Cassius and Dr. José. And we also have these wonderful friends that most of you know very well, that's Eunice and Ralph. And since 2009, we have been screening and trying to do early prevention first, early detection and treatment of cancer. And these new drugs that are becoming available, they will also change prognosis for these patients. So we also have other long-term complications, such as endocrinological complications, especially the thyroid function is very much affected in FA patients. So you need to do the annual screening and especially the thyroid echography as well. For male patients, we see more frequently hypogonadism, and up until now, no male patient in our group has had a biological child. But we have seen pregnancies in girls before transplant. At least 5 women in our group became pregnant between the age of 17 and 21. And even some of them had taken androgens before. We had at least 3 that referred to spontaneous abortion and no successful pregnancy. And 4 out of these 5 women that became pregnant received a subsequent related or unrelated transplant, and they are all doing well. We have also seen 6 pregnancies after transplant, and most of the patients really got pregnant in the early 20s, but we had one that got pregnant at almost 30 years old. None of them received TBI in the preparatory regimen. Some of them even had some very important complications, and they all wanted me to share the pictures of their families with all of you. So pregnancies after transplant and before transplant for girls are more frequent than what we have seen for boys. We cannot forget about the other complications, even though they do not impact as much as cancer and really fertility. They impact a lot quality of life. So we need to develop groups regarding pulmonary, gastrointestinal, hepatic, renal, neurological, hearing, and visual complications, not only after transplant, but also before transplant, because as I say, they can impact a lot graft quality of life. So this leads me to the Brazilian Fanconi Anemia family meetings. And in 2009, during the 4th symposium, I met these 2 wonderful people. They really changed my life and the lives of our patients. We began a friendship that words absolutely cannot describe. And they made me believe that we were able to make these family meetings in Brazil and to be more proactive regarding the screening of cancer. So based on that, in 2009, we did these family meetings, and we had up until now 5 meetings with between 90 to 100 patients every year. So in the beginning, we had very few adults, as you can see, but in 2013, we decided that we needed to focus more in the adult population, and we did an active search for the adults, and we got 42 adults in this group. And in 2015, 50 adults, and in 2017, 53 adults. November now, 2020, we are planning our first virtual meeting only for adults. And this will be something that I would like to invite anybody that would like to participate. Because of these family meetings, we also had the very active part of Rafael. Rafael is a social worker that really helps me to develop these meetings. And he decided to study what was happening to adult patients with FA. And he got together 69 patients. And he tried to describe the profile of education and professional insertion, and also to analyze the socioeconomic situation of our patients, because this would be very important for us to develop campaigns and, to know what was happening to our patients before asking them to do this and that. So he concluded for adult patients, professional training, education, social insertion were as relevant as monitoring the disease itself. Patients coming from very low socioeconomic background, especially if they live in developing countries, are very vulnerable. And social workers can help a lot to articulate support network for patients and families. And we know that not only here in Brazil, but everywhere else, it's difficult to find a job. There is a lot of competition. And for these patients, they have a lack of adequate education and qualification. And they also have to face long periods of illness that adds with poverty and lack of family support. Brazil also faces a high degree of gender and regional inequalities regarding education. And as you can see here, Curitiba is located here in the south, and patients had sometimes to travel more than 2,500 miles to reach Curitiba. So we need to develop also other centers that can see our patients before or after transplant, that are really interested in these patients. He also saw that most of the family consisted of 4 to 5 members, that most of the families also lived with less than $800 a month, that most of them were from this lower socioeconomic background. And as you can see here, the chances of completing elementary education in Brazil varies a lot if you live in the urban or the rural area. So if you live in the urban area and the lead of a family is a white male, then the chances of you getting elementary education is almost 100%, as you can see here in the blue bars. But if you go to the rural area and it's a Black woman that leads the family, then your chances of getting education is very low. And if you do not get education, you are not very well positioned in the job market. So although we had all these complications, we could see that almost 70% of our patients consider their health education to be excellent, the health situation to be excellent. We also saw that only 33% of patients had some type of paid activity, and that some patients accumulated work and study. And although we had like 36% of adult patients that neither worked or studied, and few had completed university or other form of higher education, this percentage was similar to the Brazilian population in the same age groups, unfortunately. And this study really showed the coexistence of these typical difficulties facing the Brazilian youth population, possibly aggravated by the problems related to the disease itself. So I also decided to ask what it's like to be an adult with FA in Brazil. What would be their perspective, and if that would fit with my physician perspective. And then I asked Eliana, who is a 13-year-old woman that is 25 years after transplant, what it was like to be an adult with FA. And she just answers very simply. She tries to live a normal life. That when she was younger, menopause, and that affected her before the age of 25, impacted her life a lot in a negative way. Her first marriage even was dissolved because of that, did not work because of that. She had a lot of questioning from the society why she did not have a child. And then she married again with a wonderful partner, and right now, and she said after the age of 35, she could stand up when people question her about having children or not. So she also says that maternity, fertility, and early menopause really played a lot of impact in the lives of the FA girls in Brazil. And that she, even though she had many FA male friends as well, she could not see the same thing happening to the men in our population. She had also impact in her professional life, as well as some limitations related to the disease. She also had the impact of looking either too old or either too young, because the beauty standards set for the Brazilian girls were very, very high. So her self-esteem was sometimes very low, but she just commented just like that. Oh, I know, Dr. Bonfim, Carmen, it's just vanity. I know that I'm very grateful for my life and that I have a very big support group. So although she lives a happy and productive life, she has this fear, these uncertainties about her future. She has the fear of getting older, fear of getting cancer. And she really hopes that medicine continues to find, that's how she says, medicine continues to find a way to keep all FA patients healthy and never stop trying to find a definite cure for this disease. And I asked her to send some pictures, and I could not place all the pictures that she sent me because she has many friends, and she says that friends and family are a big way of getting along with this disease. So I also asked Eduardo, who is an adult with FA in Brazil, what would be his perspective. And Eduardo is 26 years old, and he's 4 years after transplant for leukemia and Fanconi for leukemia. And he says to me that, you know, Carmen, to have FA is normal because I had no other life. But when you made me think about it, I feel like a soldier who has won the war. He's saying that, referring that to the transplant with leukemia. He was admitted with leukemia and pulmonary fungal disease. He was extremely sick when he got admitted to the transplant. So he says that he feels like he has won the war, but lives forever with this kind of post-traumatic stress disorder. He cannot concentrate, cannot work well, and he fears for his future. He worries about not being able to have a child of his own because he has heard that FA males are usually infertile, but he does not think a lot about that right now. He feels lonely and not very well understood, although he tries to get better, and he's because he needs to work a little bit more in his self-esteem. He does not blame FA for everything, but sometimes he feels like he's being punished for something and asks why he was chosen to carry this kind of weight. And when I asked him to send me some pictures to share with all of you, he said, Carmen, tell them that first it was, for me, it was God. And second, my friends and family. And here he sent me the picture with Ralph and Eunice, because when he was admitted to transplant and he was very sick, it was the German Fanconi Anemia family group that helped us, sending us a medication called IV mycophenolate, and I was able to transplant him and Vanessa, both adult patients with FA and acute leukemia, and they are both alive and well after transplant. So this is something that he never forgets. So we always, like as human beings, we need to find a reason for being here. And sometimes facing the problems that life put in front of us, we feel like this. But I really think that we need to find this wonderful reason. And I'm sorry that not all the pictures came here to this slide, but here I got picture. I had some pictures regarding the adolescents, that we need to think about the children that we have transplanted. We also need to think about the adolescents, especially because since the first meeting, most of them are now adults. We also need to know where these patients live and what they have to face when they go back to their hometown. And also here, the international group that we have with the Fanconi Anemia research found, and when they came to Brazil. So it was a very nice interaction that we had with all of them. And I'm sorry about the pictures that I don't know how it did not come together. So to finish, I'd like to say that Fanconi is a rare disease, and international collaboration is the only way to improve patient care and clinical research. Every patient counts, and one can help the other, no matter where that single patient lives. So with that, I'd like to thank everybody for the time that I had with all of you. It's the good thing about also the this pandemic, because it can put us together even though we live so far away, and especially because I'm just representing a lot of people that stand beside me and work together to make this life of FA patients much better. And especially a big thank to my BMT team as well. So thank you very much for the opportunity.
And thank you, Dr. Bonfim, for that such a comprehensive and compassionate look into FA, not only the physical aspects of it, but just to what it's like to live with FA. So very, very important. Thank you so much. Looking to see if we have some questions. And Faith is asking, is the distribution of patient complementation groups in Brazil similar to that of those in the US?
Yes, absolutely. Most of our patients, we have a very simple screening test that detects the most common 11 mutations found in the Brazilian patients. So this is a very inexpensive, and very rapidly we can detect at least 50% of our population. And we also screen FUNC-A, C, G, E, and we are beginning to screen now BRCA2. So most of our patients belong to the FUNC-A, followed by C and G. So the population is the same. And it would, I just also love the question here regarding to meet the Fanconi anemia patients. And I would very, very gladly put you all in contact with these physicians, with these patients. They really asked me about that, even though they cannot speak English very well, most of them. They would use Google Translator, and they would be really, and we had the Jason and Matt here, so they can also tell you all that you can make contact, you can communicate even though you don't speak the same language. Yeah, so please send me something later on that I can put you in touch with the patient family, with the patient group.
Okay, wonderful, thank you. And it's so true, we have the age of technology to help us with all of that, which is wonderful. And I think you can see her answer. She said, thank you very much. So it doesn't look like we have any more questions. So we just want to say thank you so very much again for such a comprehensive discussion on this very, very important aspect as well. And we'll look forward to seeing you hopefully at another meeting. Take care.
Thank you. Big hug to all of you. Bye-bye.
You too, Carmem. Thank you.